we're very happy to welcome you to this event that is our second workshop in Her Classroom. Her Classroom is an initiative of the Migration and Health Project that actually focuses on increasing access and utilization of health and mental health care services for women asylum seekers in New York City. This project is funded by Mother Cabrini Health Foundation, and it involves the collaboration between Fordham University and amazing women activists, because the project raised from the idea that the ones teaching us should be people that understand directly the experience of forced migration. So I'm very happy to welcome you, and I do hope that you will, participate. I do hope you can benefit from everything that will be shared tonight, and I do hope that you will join us for the upcoming workshops that will continue in this series. For now, I would like to introduce, our team. So our team consists of, the directors of the program, Dana Alonso, myself, and the project coordinator, Tanzilia Oren. A great team of women activists, and you'll hear about some of them that are here with us tonight in a minute, and equally great team of MSW and doctorate students in the social work program at Fordham University. With this, I'll hand this to Tanzilia.
Hi, everyone. So as Marciana said, that today we will hear from our leaders, of our women activists, who are also our co-researchers and leaders in this project. It's Deborah, it's Neka and Marthe, our 3 women activists, and Julia is our MSW, Master of Social Work student at Fordham University, who will help us to facilitate this talk today.
Thank you so much, Tanzilia. Hi, my name is Julia, and thank you all of you for being here today. Today, we're going to listen to several stories that Deborah, Marthe, and Neka will be sharing with us. And we're really lucky to be able to hear their stories to gain more insight into the lived experiences of women in forced migration contexts here in New York City, particularly in regards to healthcare and reproductive healthcare challenges and rights. So we're really grateful to these women activists for being willing to share their stories today. A huge thank you. We're really glad that you're here. Thank you for being here. And we'd like to start by asking you to consider a few questions around this topic. So first, thinking about, is the right to healthcare a human right? Are healthcare services easy to access and available to you? So what is your lived experience? And what comes to mind when you think of reproductive healthcare? So now in the chat, if you're comfortable with that, or on a piece of paper, if you wouldn't mind just jotting down some of your ideas around those questions. And specifically, how would you describe healthcare based on your experience in New York City? So if you could think of 1 or 2 words to describe what it's like for you. And then as a woman and a forced migrant, what are your main health concerns? Because we really like to know more about what matters for you. And we'll be coming back to this later after hearing from some of our women activists and speakers. So throughout our research, we found that a common theme among forced migrant women is that access to affordable, adequate, culturally sensitive, and trauma-informed healthcare for forced migrants in New York City is severely lacking. As a result of these barriers to healthcare access, this violates the basic human right to health and well-being. The International Covenant on Economic, Social, and Cultural Rights recognizes the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. This is important because a lot of times when we think of health, we think only of physical health, and it's important to keep in mind that our mental health is often neglected, but just as important. And finally, just thinking about where this is relevant, this right to health everywhere. And here in the United States, it's relevant to all states. Every state has ratified at least one international human rights treaty recognizing the right to health. And now we welcome Deborah to share her story around this topic.
Thank you, Julia, and thank you everybody for taking the time to be here with us. I'm an asylum seeker who was forced to leave my home country, Venezuela, due to political reasons in 2018. When I arrived in New York, the first job that I started was in a restaurant. And at the beginning, it was very hard. Due to physical assignments from one of the managers, I ended up having sciatica problems. Unfortunately, I do not have medical insurance and I had to suffer along with pain because I did not know where to go. One day, someone recommended me a hospital near me where they did not care about the immigration status and it was low cost. I went and they just request me my name, my address, and the income to figure out the rate that they will charge me. After this, I could see a primary doctor who gave me some pills, recommend me that I should stretch and do yoga and go for physical therapy. Even though I needed to go to those therapies, I could not afford it at that time. So my best option were to stretch and go to yoga classes. After almost 2 years, the pain has gone by almost 90% and I did not take pills for it. Currently, I also apply for TPS and I'm waiting for my approval on EED to arrive soon. And I decided not to enroll yet in an emergency Medicaid because I would like to have everything. And I was also at that time scared about the public charge. This is based on my personal decision that everybody should know. It is not something that is still going on, but in my criteria, I would like to wait for everything at this point. So my recommendation is that you talk with people, inform and research, because dealing with pain alone in a new country is difficult and sad. So do not hesitate to look for help. I think you are not alone, and now this is your space. Common barriers to accessing care in forced migrants communities are lack of or misleading information, lack of insurance, also fear around legal status and cost of care. Like I said, do not hesitate to look for help. We are here and you can visit our website, migrant.org for more information.
Thank you so much, Deborah, for sharing your story about this really important topic. Among the many barriers to healthcare, one that Deborah touched on is a very common one, which is the cost of care. So that's one theme that's present in many stories of people with lived experiences of forced migration. And now we'll hear some of those stories read by Tanzilia.
Sometimes you have insurance, but there are deductibles and so on. So you still don't go to the hospital. Prices are a problem because cost forces many women asylees, asylum seekers to seek treatment, even with insurance. Another quote, I remember the first time that I got sick in New York City 3 years ago. I was very worried about how to pay for medical attention.
Thank you so much for sharing that, Tanzilia. So when we talk about reproductive health care, we want to shift to kind of hone in on a different part of healthcare. A lot of times things around issues around pregnancy or the birth process pop into our minds. Reproductive healthcare, though, is much more comprehensive and complex than this. It can include really vital cancer screenings, such as breast cancer screenings or cervical cancer screenings. So keeping that in mind, as we move into hearing our next stories, we wanted to define reproductive health as a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. And today we're going to focus specifically on the areas in reproductive health of postpartum depression and prenatal healthcare access. Postpartum depression is a depression that's suffered by a mother following childbirth, and it typically arises from a combination of factors, hormonal changes, psychological adjustment to motherhood, and fatigue. And now Marthe was going to share her story with us, her own experience with postpartum depression, as well as some of the things that helped her and could help many other women.
Hello, everyone. My name is Marthe Kimdi, and I'm an asylum seeker. I'm from Burkina Faso. So today, thanks for coming. Thanks for your time. Today, I'm going to share with you my experience as a mother. So, but before my story, I have like a little introduction. So when thinking of a newborn baby, what comes on your mind? One typical thing of love, happiness, joy, moments that turn into lifelong memories. And we think of how beautiful mom born with her baby can be. However, a high percentage of women experience postpartum depression, or also called PPD. Mothers diagnosed with postpartum depression can experience extreme sadness, anxiety, and exhaustion, making it challenging to complete daily care activities for themselves or their babies. And my story started on October 2020. That date was the day that I can never forget in my life, because it's still like, it looked like, I feel like it happened yesterday. So I gave birth at the end of September. And right after I gave birth, I felt sad. And I thought it was the birth pain. I stayed in the hospital for 3 days. And during these 3 days, my thought became different. And anytime I was breastfeeding the baby, I was crying for no reason and felt sad. I remember the day I left the hospital without the baby, because she had to stay in the hospital. She had to stay in the blue light due to her health condition. I had a bad thought while I was still in the hospital to kill myself with the fork that I got it through I got it through my lunch tray. You know, in the hospital they give you lunch tray. I got tempted twice. God saving my life that day, because I wouldn't be here today to talk with you about my soul, to talk to you about my story. I felt shame to talk about my thought before I left the hospital. Also, I didn't speak out to my doctor because I was scared that she may take my baby away from me. After I got home, from the hospital, my thought became worse and worse until one day I was crying in the shower and I took long time. My spouse asked me what the matter was, and I replied, I want to die and all my pain will end. He was sad when he heard what I just told him, and he immediately asked me to call my doctor, and I refused it until he convinced me, and I finally reaching my doctor, and she immediately find a therapist for me, and we start the therapist the following week. Suicide, cry, and sadness were my postpartum depression. I work with my therapist to save me and my newborn life. It took me 4 months to get off of this thought. That was the sad moment I went through. Postpartum depression can be reduced or prevented if pregnant women have a counselor who helps them mentally and emotionally prevent postpartum depression or PPD. Feeling hopeless or empty after childbirth is not a regular or expected part of being a mother. No. For many women, the baby blue goes away in 3 or 5 days. If your baby blue don't go away, or you feel sad, hopeless, or empty for longer than 2 weeks, you may have postpartum depression. Women are affected by many of the same health conditions as men, but women experience differently. So women face particularly health issue and particularly form of discrimination, group including refugees or internally displaced women facing multiple forms of discrimination barrier and marginalization in addition to gender discrimination. Factors such as a person's socioeconomic background, income, or race profoundly impact of developing this condition of postpartum depression and the likelihood of receiving the care and treatment. That was my story. And I hope you guys, by hearing my story, you guys learn with like anybody who have any problem, issue like Marthe's story, right away you have to contact your doctor or your GYN and let them know, because postpartum depression is very serious and it's affecting a lot of women. Thank you.
So much. Thank you so much, Marthe, for really sharing about this truly important topic. Thinking a little bit more about reproductive health care, we wanted to focus a bit on prenatal health care. This is also an issue that affects many women in forced migrant communities in New York City. Prenatal health care is medical care that you receive while you're pregnant. And we're going to hear from Nneka, who will share her story and her struggles with accessing prenatal care and some really relevant information that you could benefit from around this topic.
Hello, everyone. My name is Nneka. I'm an asylum seeker who fled my country due to persecution. I was pregnant at the time I arrived at the United States in 2019, and I had no knowledge of the laws protecting pregnant women in the United States. As a result of the stress of the persecution in my country, I was afraid my baby was not moving. So I needed immediate medical attention, even if it was just to hear my baby's heartbeat. I was, however, afraid of the public charge rule and how it will affect me as an immigrant. So I couldn't go to the hospital to get medical help. This went on for a while and I did not get any prenatal care until 24 weeks into my pregnancy, notwithstanding that I fell into the high-risk pregnancy category. One day I decided to just walk into the emergency unit of a hospital in Bronx, New York, and I was afraid when I was asked to provide information as to my address and my means of identification. At that point, I did not care about what would happen to me, but just to be sure of the safety of my child. I was happy when they immediately admitted me in for evaluation and checked on my baby. I was referred to a gynecologist after I was deemed qualified for Medicaid by virtue of my pregnancy. I was further informed by one of the staff of the hospital that Medicaid was a program that offers complete pregnancy care and other health services to women and teens who live in New York State and meet income and residency guidelines. If you're pregnant and uninsured, you may qualify to sign up for an insurance plan through the New York State of Health Marketplace, even if the enrollment period is closed. You could also get free coverage regardless of immigration status. Extended access to family planning services is available to women who have Medicaid while pregnant, but lose coverage after pregnancy. Also, babies receive health care services for at least 1 year after birth. Thank you.
Thank you so much to NECA for sharing that really powerful story with us. And now we'd like to leave you with a couple of thoughts as we close up our session.
So to wrap up, some important points to consider would be misinformation or lack of information oftentimes creates a barrier to accessing healthcare for forced migrants. Cost is a common barrier to accessing quality care in the forced migrant community. Lack of access to quality health care causes physical and psychological stress. Other stressors that affect forced migrants are illegal status and financial and housing insecurity. All of these stressors increase the risk of retriggering trauma in forced migrant communities. So every person has a right to health care regardless of immigration status.
Healthcare and reproductive healthcare services are available on this link below. We have for reproductive health services option. You can visit www. You can visit http like immigrant.hub.org resource/pregnancy. And also for general health services option, you can visit https://migrant.hub.org/resources.health for anybody who would like more information. Sharing useful information with your community. If you could share one thing that you're learning today with member of your community, what will be? What else will you like to know about women's health that was not covered in our presentation today? Please feel free to ask any question you want. Thanks.
Thank you so much for sharing that information with us, Deborah and Marthe. And in closing, we definitely would like to thank all of you for being here and for taking the time to listen to these powerful stories of resilience. And we would really like to hear more reactions about what you heard today. So again, if you want to share more in the chat, we'd love to hear more from you. And as Marthe said, if you have any questions or anything. And I'm going to pass it off to Dana, who I think wanted to say some words as well.
Yeah, I just wonder if we want to give folks just a second or two to see if anything comes up in the chat. I think that we heard some really powerful experiences, and thank you so much to those of you who put yourself in that vulnerable position and were willing to share your experiences with us. I think it may be a lot to process and take in, but I am starting to see a couple of comments come into the chat, and I think that this last comment that was just posted about sometimes we don't even know that we're able to look for resources, right? Or we don't know where to go to look for resources, and I think that that's a very common experience, and I think that it's something that's important to think about. If we go back to the questions that we asked you to consider in the beginning of our talk tonight, we asked you to consider, is healthcare a human right? Right? Is access to care actually easy for everyone? Right? And what does accessing care in New York City in particular look like? And I think what we heard in the stories this evening is that we might think that in a big urban center like New York City, right, the city that never sleeps, that it's very easy to access care, but in fact, there are many barriers for women asylum seekers, and it might not be actually as easy as one might assume, right? And things like costs, like fear, and cultural barriers have a tremendous impact on the kind of care that women are able to receive, the kind of information that they have to make decisions about the kind of care that's available to them, the resources that are made known, and as was shared in the chat, whether or not we as a community make it clear that services are available. Right? And so as we leave you tonight, I think what we'd like to you to take away from this is, what does all of this mean? What do I do about this information? What can I do to address some of the concerns raised? And if you are a woman asylum seeker who are part of this community, hopefully you're taking away that you do have a right to care, and that there are things that you might fear in terms of status. Hopefully you receive some information that will help lessen some of that fear and allow you to reach out for care. And for those of you who are just here to support the community, I think we need to be considering what are the advocacy efforts that we need to make to help ensure that access to care is as easy as we would want to believe it is. I think Marthe, you wanted to say something before we end?
I wanted to add something. Usually, most of the immigrant, most of the women, they are feared to like access healthcare. Like let's say like me, when I just came here, like I was scared for my studies. I don't want to go to get any like insurance because I don't know. I may go to give my information, and the next day I will see the cop in front of my apartment. So many of women are very scared. Why? Due to the studies. Again, on top of the what Trump brought, saying that if you use public assistance aid, it may affect. Many people think it's affect to asylum seeker. No, asylum seeker and refugees are not in that category. So feel free Don't think like, oh, if I take the public, if I go to get Medicare or something like that, it may affect my interview, the day of my asylum interview. No, it's not going to affect your day of the asylum interview because you have a right to have to get a health care. Thanks.
I think that's such an important point for us to maybe walk away with, right? Healthcare is a human right, and we do need to take advantage of that right, and reach out and demand, right, the kind of care that we need for ourselves. Thank you so much all for joining us this evening. And we hope, as Marciana said in the beginning, we hope you join us again for our next talk, and to continue to support this community and to continue to hear the voices of the women who are managing these kinds of struggles on a day-to-day basis. Thank you so much.